In this video, I'm going to show you 2 exercises to strengthen your hip flexors. You're not trying to go. You can do these 2 exercises at home, and when you first start, you don't need any equipment at all. By the end of this video, you're going to understand how to do these 2 exercises, the relevant anatomy involved in hip flexion, and what the heck hip flexion is, and you're going to have a path to building stronger hip flexors. So if you're ready, let's get ready to think right, move right, and feel right. First, let's quickly cover what hip flexion is. It's when you bring your femur up towards the sky or closer to your chest.
I did not give consent for that.
I didn't give consent for you to live rent-free in my house. The term hip flexion should not be confused with when you are just flexing muscles. Flexing muscles is a way of saying contracting muscles. So if you say you're flexing the hip, we're not talking about contracting hip muscles. We're talking very specifically about the femur going in this direction, moving in this front-back plane called the sagittal plane, and going forward like this. The opposite motion is hip extension, which is when the femur goes back this way, meaning it's going behind your body. Also, once you're done learning these exercises, I'm going to link to a video at the end of this one that'll show you how to use the right level of effort to strengthen your hip flexors without getting yourself hurt. So be sure to watch that video after you're finished with this one. The hip flexor muscles are not just 1 or 2 muscles. There are a bunch of muscles involved in hip flexion. First of all, there are the classic hip flexors that everybody knows, which are the iliopsoas, which starts here on the inside of your femur and goes up to your lower back. It attaches to the front of your lumbar spine. There's also a muscle that starts there that attaches to the inside front of your pelvis called the iliacus. And now everyone thinks, okay, there we go, we covered hip flexors, done. But in fact, there are many more muscles that help you with hip flexion. Rectus femoris is one of the quadriceps muscles, and it goes from the front of the pelvis down to the knee, and it helps you do that. You also have your adductors, which attach to the front and the bottom of your pelvis and down towards the knee and to various points on the thigh, and those function to create hip flexion as well, depending on the position you're in. You also have muscles like the gluteus minimus, gluteus medius, the tensor fasciolata on the side of the pelvis that can help you create hip flexion. Again, that can vary based on your leg position, but the point is that all of these muscles are going to help you with hip flexion, so don't just get caught up thinking, oh, I just need to strengthen my iliopsoas. When you're doing hip flexor exercises, you might feel different muscles kick in, and that's okay. In a previous video, I talked about doing the can-can exercise, which is to just lift your knee up towards the ceiling and sky like so. You slowly lower it down with control and lift it back up with control. If you want more challenge, you keep your leg up, you put some weight on your leg or ankle weights on the bottom of your leg, and you keep going to fatigue, keeping it at a reasonable challenge, not trying to kill yourself. But for some people, this is a really big balance challenge and it's just too distracting. There are too many moving pieces. Holding on to something might be okay, but maybe you're so weak that just standing on one leg doesn't really work for you. So let me show you the first hip flexor exercise that doesn't involve balance that you can do at home anywhere. You're just gonna be sitting down. You're gonna lift your leg up. This should look very familiar. This is the exact same exercise as the can-can, except you are sitting down, you're nice and stable, and you have a reduced range of motion. What's nice here is you're actually strengthening the hip flexors in a shortened position, meaning the top position where the muscles are all shortened. Lengthened would be when you're more in hip extension and then those muscles are longer. When we're already in the seated position, those muscles are in a shortened position and then we're firing them and strengthening them in that shortened range.
Why does this matter?
When we're strengthening any muscle, we want to build strength at every length. We want to have control of muscles at every possible length that they can do. So we're starting off in this shortened position, which is a position that we almost never train our hip flexors. In fact, many of us don't train our hip flexors at all. Most of the time we're just sitting like this and our hip flexors are sort of working just a little bit, but they atrophy because they're never working against any kind of resistance. So when you're doing this exercise, lifting and lowering, you're getting resistance from gravity and the mass of your actual leg. For some people, this is enough challenge to start. You're gonna feel like, my leg is kind of heavy. You're gonna do this for repetitions. It might be 10, it might be 20 repetitions, or you can just hold that top position until you start to feel muscles around the front of your hip start to complain. When you first start, I would recommend keeping the shin vertical, and we'll talk about what you can do to mess around with that later because that is going to matter. If this feels really easy, you can throw on an ankle weight here, or you can put the weight up on top of your thigh. It doesn't really matter. And then you can just do the same exercise, making sure the weight stays on your body. Keep going until you get fatigue. Again, don't cripple yourself with soreness. Just look for a reasonable challenge, somewhere around 70% of your max effort. If you can't breathe and it feels like a vein is going to explode on your forehead or in your neck, then you're trying way too hard. Make sure that you are just fatiguing muscles and getting used to talking to those muscles. That's all you're looking for. You're not trying to go. And when you're ready for more challenge, you can get more weight, just like a dumbbell, and put it on top of your leg, and then you can practice lifting that dumbbell using your hip flexor muscles.
Okay, how do we strengthen the hip flexors in a lengthened position?
Great question. So to strengthen the hip flexors in a lengthened position, you're going to want to lie down on a couch or bench, somewhere you can let the leg come down into a little bit of hip extension if possible. Just going into this position might feel like a bit of a stretch for various muscles on the front of your hip, and so it'll be good for you to just spend some time like this to lengthen those muscles. Now, to get control of this position, we want to again build strength at every length. So in this lengthened position, we're going to then start lifting the leg up. Now, as you get to, I don't know what that is, 70-ish degrees, you're going to feel like there's not that much resistance anymore because your leg is approaching vertical. It's not that heavy, it's not that hard to pull it anymore, so the hip flexors aren't getting that much challenge. So you don't have to go all the way to 90 degrees, but you can if you want to. Where you're going to feel the most work happen is at the bottom position all the way up to around like 65, 70 degrees. You're going to feel hip flexors working through that arc. If you want the extra credit, go all the way through the arc, but if not, then just go through that more difficult area here. I do recommend that you have a long enough bench that you can rest your head. If you want more ab work, then lift your head up like I'm doing here and hold it up. Your neck muscles are also going to get a nice little challenge, but if all of that is too distracting and you get too tired, your neck is like, then please use something to support your head, okay? You can even use your hand like this. So again, you're just going to fatigue. It might be 5, it might be 10, it might be 20 repetitions. You're trying to really strengthen the muscles at this lengthened position. You can play around with this by even doing little flutter kicks down here at the bottom position to really focus on the lengthened position, or you could do it higher up. Find where it just feels weak and a little out of control, and just keep strengthening that range so that you have strength at every length. If you want more of a challenge, just grab a light ankle weight. Do not use a 10-pound ankle weight to start. Start off with something light. Even if you have a 5-pound ankle weight, maybe just start it with 1 pound and then throw that on there. You're gonna lie back, do the exercise the exact same way, focusing on feeling muscles in the front of the hip. Also, when you're doing this, make sure that the foot and the knee are pointing up towards the sky. We're not going to deviate so that the leg is twisted or externally rotated unless we're doing that intentionally. Same goes for internal rotation. We want to be very intentional. We want to have volition at every position. So we're not going to do that and allow the leg to get in weird positions unless we are absolutely choosing to do that, which we're going to talk about in a second. One final thing to note is when you're doing this exercise, it's very helpful to hug the knee towards your chest, or at least to have the leg in a bent position with the foot flat on the bench. If you have the leg like this, you're probably going to arch your back heavily, and that's not what we want to do. We want to have the low back as flat and rounded even, pressing down as we can so that we can focus on getting these muscles to lengthen rather than the back to lift off of the bench. For both of these exercises, you want to do them on both sides, and whichever side is weaker, because I know you have a weaker side, do an extra set. So if you're doing 2 sets on both legs, then do a 3rd set for the weaker leg. When you first start, do these exercises twice a week to start, and give yourself rest days in between. So do it like Monday, Thursday, or Tuesday, Saturday, so that you can let the soreness kick in and dissipate before you start doing the workout again. Hey, I want to give a big shout out and thanks to the 5 people who have become $5 supporters on Patreon. Chef Jeff, Rick, Doug, Kim, and Esme, thank you all so much for your $5 pledge. If you want to support this channel too, use the donate link you'll find in the description box or the join and thanks buttons on YouTube. Make sure to go to my website to get on my newsletter and find me on all those other social media channels. But don't get caught up in too much social media. Just follow me, even though I don't really post that much. All right, thanks so much for your support. Now let's get back to it. As you get stronger and more familiar with how these exercises feel and how your body responds, then you can bump it up as you feel comfortable. I also strongly suggest you watch the video I made about using the right level of effort to fix your hip flexors and make them stronger. I'm going to link to that at the end of the video and in the description box, so be sure to watch that when you're done with this one. Now, I mentioned we can play around with variables like twisting and turning and leg position, so let's talk about that right now. When you're doing the seated hip flexor lift and you feel like you want to explore a little bit, you can start adding bits of rotation to your femur. For example, what I'm doing right now is called hip external rotation. It's the front of this femur bone rotating to point out to the side, and then I can still work on hip flexion. This is going to help me use my adductors and my sartorius muscle, which I forgot to mention earlier in the video as being a hip flexor. And you may be wondering, why would I want to do that? And the reason is because you want to have options. You want to have volition at every position. So let's say you're involved in a sport that requires you to do weird stuff, like say soccer. In soccer, you have to do a motion like this, where you combine external rotation with flexion so that you can control and juggle the ball. Likewise, you might also want to be able to do hip internal rotation and hip flexion, so you can work on that in this position. Sitting down, internal rotation, meaning the top of this femur, the front of the femur, turns the point in, and then here you go. You can work on hip flexion with internal rotation, with external rotation, and again, if we use this soccer or a hacky sack analogy, when you're doing stuff, you might want your leg to be able to go out to other positions. So you might want to add abduction, meaning away from the midline, and work on hip flexion here. You might want to work on adduction, meaning you bring it across the midline, and it can be really helpful to just kind of twist to really accentuate it. So it's like this leg is sticking out, this one is back here, so I'm twisted, and then work on hip flexion from this position. You can even combine these things by going into abduction, external rotation, and then lifting. You want to find the positions and the angles that are just tough for you to control. Maybe it's out here, maybe it's just right here, maybe it's with a little rotation in whatever direction. You can work on those variables to help you get more stable in a wide variety of positions. And when you're lying down on your back, you can do the same thing. You could be a little more abducted if you want. You could add external rotation, just making sure that you feel different muscles working and you feel it safely. The goal here is to have control when you're going through that range of motion and not going in anything that hurts or pushing through anything that feels like it's going to pop. Stay in a controlled range of motion and gradually expand the range of motion so that you have volition at every position. You can go external, you can go internal, abducted, adducted, whatever you want is fine as long as it feels like it's controlled and safe. And of course, as you get better at the seated exercise, you might feel like, you know what, I want to start doing the standing version of that exercise. That's totally fine too. Again, adding ankle weights is a great idea, or you can use a dumbbell and just put it right here like this and then work on lifting. So you'll get the most resistance through the higher end of the range of motion and not so much down at this position, and that's okay because you're trying to strengthen at the shortened position. So now you've got two simple exercises to strengthen your hip flexors at home. After you try them, let me know how they feel in the comment section down below. I promised I would link to the video that'll help you find the right effort to strengthen your hip flexors, and you'll find that video right here. To support this channel, use the donate link you'll find in the description box or the join and thanks buttons on YouTube. Like, share, and subscribe with the bell notification on, and as always, I hope you remember that pain sucks, life shouldn't.